The human spine is made up of a series of bones that are held together by ligaments, mostly but partly by muscles. And the spinal cord is protected by the spine. Each bone or vertebra is separated by a disc. Okay? The disc, you can consider it almost like a jelly-filled donut. The outer membrane is almost like a ligament that contains or holds the jelly-like substance on the inside. So this is a spacer between our bones. The nerves, which come out of the spinal cord or off the spinal cord, come through small canals or openings in between the bones and separated by the discs. There's three main functions of a disc. One, acts like a shock absorber, just like the shocks in our car. Two, it's a spacer. It spaces between the vertebra and it maintains an opening for the nerve. And the third one is it allows flexibility, bending, twisting. If this was all solid bone, we would have very little flexibility. So it allows for flexibility, twisting, and bending. So those are the three main functions of what that disc is. There is no blood supply to the disc. So the disc depends on motion in the spine to get its nutrients. Now the nutrients come from, this disc would get its nutrients from the vertebra above and the vertebra below. And this is why sometimes you can get degeneration at different levels. When these are injured, you're going to get degeneration at this joint. But the nutrients into that disc are dependent on motion. So motion acts like a pump to get the nutrients in, the water in, and the toxins out. Obviously, if that process gets damaged, then we affect the three functions of the disc. We're going to talk about decreased motion, and with decreased motion comes decreased pump. And the main fluid or substance that the pump pumps is water. Water is what hydrates our disc and keeps it tall. So as our pump gets less efficient, we get less disc height. Less disc height causes a couple problems. Less disc height causes compression on the nerves. So this kind of helps explain how a housewife or someone who's never played contact sports or never had any serious injuries, how do they get a herniated disc? How do they get spinal degeneration? Because they have chronic, poor motion in the spine. So as that disc becomes a problem, and let's say less hydrated, the annulus or the ligament that contains that disc starts to develop tears, cracks, and that's what leads to a bulge. So that would be then a bulging disc. So the nucleus is starting to protrude out of the disc, and as a result, the protruding disc closes off the size of the hole where the nerve comes out. That causes a pinched nerve, or you get a bulging disc or a herniated disc, but that is really what closes up the size of the hole and makes the hole smaller and causes the impingement on the nerve, and then people get numbness, tingling, typically called sciatica when it's in the low back. They'll get pain in the low back, sometimes in the buttocks, and then sometimes right down the leg. So now that you understand why you have back pain and poor motion, what are we going to do about it? We're going to use the back loop. The back loop is our user-friendly, portable, simple device that we get motion into the lower spine. The other way to get motion into the lower spine is walking correctly. We are going to cover walking on a different day, but those are the two methods to do that. If we imagine that the balloon is our disc between two of our vertebrae, and now I'm going to compress it. So you can see as I press it, my fingers above and below are, let's pretend they're vertebrae. So as I pull the vertebra from top and bottom, the bulging portion of the disc gets narrower. So the concept of pulling the vertebrae from both ends causes the disc to get narrower in the middle. That's the whole idea of of reducing or sort of sucking back in and creating that negative pressure that's needed to get the disc back in and get the pressure off the nerve. So you can see it also if I grab the ends of the balloon and I pull. The center gets smaller. Why is this important? If the disc hits the nerve, even if it's subclinical, in other words, there's no pain, that nerve doesn't allow that muscle to engage as well as it should. So the muscle's clinically or even subclinically weaker. So then the athlete goes out and he doesn't perform as well, he can't run as fast, he can't jump as high. That's the whole concept of this back loop. Now the great thing about the back loop is you can transition within the loop from tension to no tension. So we really get that suction effect quickly, far quicker than a spinal decompression table. There's about a 40-second lag or a 60-second lag time between this and that. We can accomplish very quickly changes just by taking weight off our feet and bending our knees. So the back loop allows us to do something quicker than the mechanical devices that are used by chiropractors, PTs, and some medical doctors. We've done a video fluoroscopy of someone in the back loop to show you exactly how it works. There's lots of internet animations on what spinal decompression is supposed to do, and I believe we're the first to actually get it on film to actually show you what it's doing. What you're going to see on this video clip is the disc space getting bigger. You can't see the discs on an x-ray, but you can see the vertebra. So you're going to see vertebra 1, vertebra 2. You're going to see the disc space get bigger, almost like when I pulled the balloon apart. So you can imagine that's what's happening with this disc. The other thing you're going to see is the canal where the nerve comes out or goes through. You're going to see it's going to be a white space because there's no bone there. And you're going to see this white space because half of the opening comes from one bone and half comes from the other. You're going to see this white space get bigger. So you can imagine that if you got a nerve in there and you got inflammation in where that nerve root is, you're going to help open up that space and it's going to create a pumping action and you're going to get inflammation out of that space and you're going to increase the size of that space. Obviously, if you have back pain, you're going to use the back loop. But the best time to use the back loop is right before you go to sleep. Because when you use it, you decompress your spine, take the pressure off the nerves, and now you're going to bed in a horizontal position, which is the least compressive position to your spine. So when you stay like that for 6 to 8 hours, your body starts to get that new position and it starts to know it. What is it going to affect? It's going to affect a lot of things. Your performance, how high you can jump, how fast you can run, your flexibility, long-term posture, huge for posture, and even bigger picture, how do you prevent spinal degeneration? Utilize the back loop, get motion in the spine. When you get motion in the disc, you activate the pump hydrates the disc, takes the pressure off the nerves, and you do better. Couple this with walking correctly, which very few people do, and you do a lot better, way less pain, way better quality of life.